The morning after pill is rarely discussed in popular culture, and unfortunately, like many subjects that involve the female body, it is still shrouded in stigma. This makes it a difficult topic to bring up and therefore a difficult subject to find information on. So when you need emergency contraception, where do you begin? I'm Brooke, I'm an obstetrics and gynecology doctor, and I have regular conversations in clinic about contraception. There's so many misconceptions about the morning after pill or the emergency options, so I am here to clear them up. Let's start with the name. You probably know it as the morning after pill, but it's important to clarify that doctors tend to refer to it as emergency contraception, and that's to avoid the misconception that it can only be administered the morning after sexual intercourse. In fact, both the pill options that are available in the UK as well as the IUD can all be effective even 3 to 5 days after sex, although keep in mind that it is still one of those ASAP situations. We also call it emergency contraception to make it clear that this shouldn't be a regular option that you should rely on. Yes, it's nice to know it's available in the back of your mind, but as we'll get to later in this video, it's not as reliable as contraception that is taken on a regular basis. So if you are certain about wanting to avoid an unplanned pregnancy, there are better options out there for you. Why does the stigma exist? Sometimes it's just unjustified embarrassment over having had unprotected sex. Things happen, it is nothing to be ashamed of. And sometimes it's due to the misconception that taking the morning after pill causes an abortion. It doesn't. So there's long been a silence about this much needed treatment. I hate stigma, but I get why you might not want to go into a pharmacy shouting that you want emergency contraception at the top of your voice. Either way, it's best to be informed about your options, so let's dive in. Who can take emergency contraception? Most women and people who have periods can use it, even those who can't use hormonal contraception. There are a few caveats to that. So if you have any allergies to any of the ingredients, if you've got a history of asthma, or if you're taking other medications, do discuss it with your doctor first. What are they and what do they do? Well, there's two main types available in the UK, Levenel or Ellaone. So both of these pills work by preventing or delaying ovulation. So how effective they are does sort of depend on where you are in your cycle, because they're delaying you from ovulating, so preventing that embryo from being formed. It's best to take them as soon as possible after unprotected sex, ideally within 72 hours, but some of them can be effective up to 120 hours or 5 days later. And you can purchase them over the counter at a pharmacy without a prescription, or you can also get them for free from sexual health clinics or from your GP. Now, levonorgestrel based pills, like Levenel, are the most commonly available. They're most effective when you take them as soon as possible after unprotected sex, but they can be effective up to 72 hours, so 3 days later. Some people even say they might have still some effect 5 days later. They are 98% effective, and they are appropriate for most people in most medical circumstances. By comparison, the other options, so the ulipristal acetate-based pills, like Ellaone, are 99% effective, and they work for longer. They are effective up to 120 hours or 5 days after the intercourse. And they may be more effective than the levonorgestrel based options if you're in the later stages of your menstrual cycle. How do they work? Well, overall, it depends on where you are in your cycle. They either prevent the sperm from fertilizing your egg by temporarily stopping the release of an egg from your ovary, or they prevent the fertilized egg from implanting in the uterus. It's very clever. One thing's for sure, they don't cause an abortion because no pregnancy has ever actually implanted in the womb. If that has already happened, those pills won't work. Do keep in mind that this emergency contraception is not effective as a regular form of contraception. So if you've already ovulated, you may already be pregnant, it won't work. When can you take it? Well, whatever you do, go and get it as soon as you can. How long it's been since you had unprotected sex will determine which options you get. So if it's within 3 days, you may get Levenel. If it's been already nearly 5 days since you had unprotected sex, your only options will be Ellaone or having an IUD. Remember, the longer it's been, the less effective that emergency contraception will be. An IUD can also be used as a form of emergency contraception, and that's because it can be fitted up to 5 days after having unprotected sex in order to be effective, and then it has the added bonus of providing you with reliable long-term contraception afterwards. So yeah, the IUD, which is a small T-shaped plastic and copper device that's inserted in your uterus, can stop eggs implanting or being fertilized. So if it's inserted at the time, less than 1% of women who use one will get pregnant. So what about the side effects? Luckily, there aren't any serious side effects of taking emergency contraception, but as with any medication, there can be some. In this case, it can bring on headaches or even stomach pain, can make you feel sick, nauseous, or you may even vomit. If you are sick within 2 hours of taking Levenel or 3 hours of taking Ellaone, be sure to see your GP or your pharmacist because you may need another dose. You might also notice that it messes up your cycle slightly because your next period may be on time, it may come earlier, or may be late. If your period is over a week late, make sure that you do a pregnancy test to be sure. So let me know if you have any other questions or comments about emergency contraception in the comments below.